lives and feeling that I am doing the ultimate. And then here the situation was something completely different. That was the time I made my decision of changing my direction from the ICU, the comfort of an ICU, into the remote regions of the country. India spends very little money on health, and certain sections of the society have not took the benefit of the advances which we are making. We may be economically improving, healthcare may be accessible to certain urban and semi-urban areas, but when it comes to tribal regions, it is inaccessible. So we took that journey of trying to address the needs of the deserving or the neglected sections of the society. That's how our journey of NICE Foundation started. So I'll run through some of the slides. This is how the woman is carried on a journey to the nearest healthcare facility. Even today, this happens. This picture was taken 1.5 years back. A woman crossing the stream in active labor carried by women. And then a journey where more able people are taking her to the nearest healthcare facility. So given this background, we came out with a model where we identified educated, sometimes qualified nurses from the region, skilled them up to the need and necessity of the time, and then employed them and started the service called a fixed day service. So every tribal village, we run a clinic 2 hours every week once. Some regions we visit twice a week. So as to, we have trained them in safe delivery procedures, bring them to Hyderabad in our facility in Hyderabad, skilling them, making them able, capable, and then putting them back there. There are some roads where they can go on 2-wheelers, 4-wheelers, and there are kacha roads they need to travel. After that, the ritual starts. These are my team members. This is happening in the present seasons also. This is not an old picture. This is the last year's picture, last season. And we, irrespective of the situation, whether it is a holiday, monsoon day, curfew day, we run our clinics on the stipulated time in these regions. That's how we got the confidence of the communities. The moment we reach, our team reaches, the community comes and for the services. Antenatal care happens. And then some women who don't come to the facility, we go to their village or to their houses and then examine the babies and then themselves, checking their weights. And then everybody's needs are addressed as far as healthcare is concerned. This is the last mile healthcare delivery model. Children, women, and in every village there are some women who are bedridden. Even in the small hamlets, 1 or 2 women are bedridden. We, after running the clinic at a stipulated place, my team members go to the village and do provide the service at the doorstep. Not only that, we have also taken on a part of empowering the community through the activity of PLA, participatory learning and action. We understand their problems and make themselves come out with a solution and see that they follow that solution uniformly. This is one such activity in a tribal region called Mananur Forest in Telangana. And then we also do PDG activity, participatory discussion group activity, wherein expected women and then lifestyle disease patients are educated on their problem to address their problems. After coming this far, we found that there is a need to build the capability of the traditional healers whose the community has confidence in. So we built up a capabilities of the traditional birth attendants through a program called TBA training program, wherein they are trained how to resuscitate a newborn, how to conduct a clean delivery. This is one such training model. So you can see the confidence of a tribal resuscitating the newborn. Obviously it's a mannequin which she's experimenting on. even my neonatal unit fellows, I don't see that much amount of confidence when they are resuscitating a baby. You can look at the smile and the confidence and then with which the posture she is able to handle the prospective newborn. That is the tribal program which we are running. We are running in 864 villages in 5 states in the country at this point of time. Then the next program of ours was school healthcare program. In our country, the poorest of the poor send their children to the government school. Even if you have little bit of money, you send them to a private school. Only children whose parents cannot afford anything send their children to government schools. For me, he is the first citizen of the country. The child who is accessing the government school is the first citizen of the country. I'll tell you why. He would not have eaten that day because we have done a study. 14% of government school accessing children in Hyderabad 10 years back, the midday meal was the first meal. In a city like Hyderabad, we are working in 256 government schools in Bhadarpura, Bandaguda, Asiknagar, Sheikpet and Golconda schools. This is the statistics. I don't think it has changed much even now. So this child, parents not educated, there are no books much, no clothing much, stomach empty, and then he is going to a school which may not be functioning well, teacher may not be coming well, in spite of all these compromises. This child is accessing the school to become himself an educated citizen of our country. We need to support this sort of a citizen. That's the reason why I say the first citizen of the country is the government school accessing child. So this program we started as a school healthcare model which is implemented in Hyderabad and went to Rajasthan, and then after our success story, 11 5-year plan of the country took up this model as a model for the country. So these are some of the pictures of the school healthcare intervention program which we are running now. We also try to educate children because we found that educating a children is like educating the family. So all the basic habits and clean hygienic methods of living are educated to these children. Hand washing, this we started much before COVID. So it was helpful for us. These are all before COVID. And we also use transit walks in the village, Youth on a World Health Day. Those sort of activities we entertain and educate the communities through children. And then about the nutrition. Today's world, as you know, educated, uneducated, rich, poor, what we are eating is not appropriate. There is a need to eat the right kind of food. So we take efforts to see that these children are educated on the best habits of eating. And then this again, hand wash. In this background came the COVID. So we were working in tribal regions. We are working in Domriguda, Ukumbeda, Munchimut, Anantagiri, Chintapalli, Madugula, Araku and Paderu mandals of Visakhapatnam. We are working for the last 20 years now. So we found that we were the only support for them during this period. And then quickly within 2 weeks time, we turn around. We build the capabilities of ASHA workers in villages where there was an ASHA worker. If there was no ASHA worker, an educated girl, we trained them through our online training platform module, how to record a temperature, and then how to do the pulse oximetry, and then whoever is having temperature or low saturations were again confirmed through a rapid antigen test. And then if they are found positive, we were giving the drugs. This we effectively ran for 2.5 months in this period, in that period where there was no way there was any access to healthcare in these regions. 1,800 villages we covered during that time. 28 patients were positive, were moved to institutions, all of them have come back to their villages. And then we also promoted the vaccine uptake in these communities. This is all because the time was short. I didn't want to take. We are doing many more projects. We do cluster randomized trials in the field, and then we are also doing different templates. We call the CHIP Community Health Intervention Program, and then of late we have graduated to a program called Adarsha Gramam, where the focus is on pre-primary care. India is a country of numbers, and then we may be having the maximum number of young population in the world, but we also are known for the diabetes capital of the world, and we are also very soon will be known as the cancer capital of the world. There is a need to create awareness in the community in terms of eating habits, in terms of lifestyle diseases, and in terms of cancer detection, and then further care. We are on that journey, and then the idea is to create new templates, ask the stakeholders to take it further. That's the principle of our organization. Thank you.
Thank you very much. Thank you very much, Dr. Padmanabh Reddy Garu, for highlighting the crucial message that healthcare is the basic human right. May I now invite Veena Gundavalli to come on board and give a memento of appreciation for Dr. Padmanabh.
Before that, if there are any queries or any doubts or anything which community wants to, yep.
Sir, first of all, I appreciate the So somehow are you connecting nursing colleges for such a foundation work? Because you are all close to grassroots level. So these upcoming nursing students who are always looking for the hands-on practices of such kind of aspect. So sir, any strategy or plan we have as a nice foundation to connect different nursing colleges across India so that we can even reach out?
I also was in that mode before I reached those places. So the reality is, in our country, tribals are positively discriminated. When I say positively discriminated, when an educated girl becomes a nurse, she's immediately absorbed into the government system. Once that girl gets into the government system, she doesn't want to come back to the tribal region. So in the regions which we work, we don't have healthcare people at all. So the idea of connected to the nursing colleges does not happen. So that's point number one. The second part of it is, the community believes in the traditional healers. At this point of time, they are the only support systems for them. So we are working through them. We are building the capabilities and capacities of the traditional healers and traditional birth attendants to see that they are my last mile soldiers to deliver care. We are also recognized by the Skill Council of India to run skilling programs. So we skill and certify programs in those regions. We run a program called Arogya Doot program, where home healthcare professionals will train through a 45-day module, which is certified by the Skill Council of India. So that's the need of the hour.
Thank you so much, Dr. Padmanabh Garu, and amazing work in the grassroots levels. And one, again, simple message I'm able to observe is you're a doctor and you're finding, purpose in helping, in your own field in different ways, to the community. And here there are aspiring, whether it's medical professionals or engineers, etc. So is there any way any of these people can add and contribute and be part of, the mission that you have established?
So we run effective internship programs. We are open to interns coming in and going through our programs, and then we have support systems. We all the time, we are associated with 3 Western world universities. We get faculties from there. We have exchange programs. So there is a lot to learn in these programs. So I would encourage people during your summer vacations, try to spend some time with us. And then, because I'll tell you, my journey, I was educated in a government school in a rural setting. And even today, those learnings are fresh in me. So during that time, when I was a young child, an American couple came to my village Through the day, they examined all the people of the village, and in the evening, they showed a film connected with agriculture and nutrition. To date, it is embedded in me. That is the seed of what we are doing to the community now. So the purpose of me standing here, sharing this information with you all, is to that we want to ignite that in you. Because someday, some opportunity when you get, avail it. And then I got the opportunity, the biggest in my life. I'm enjoying it. I got retired when I was 40. I don't do commercial work. I'm only running the foundation and trying to do the best to the community silently as a catalyst.
Thank you so much, and a big call out for all the students who are interested in any sort of internships. You can be in marketing and promote the cause. You can be in finance and support, whatever the activities they're doing in finance department. You can be an engineer. You can do data analytics. You can do, all sorts of, technology work, for this particular one. So please meet later on, with Dr. Padmanabha Garu and sign up with the NICE Foundation for additional activities. Thank you so much. Thank you.
Just a moment, sir.
Now we will have a small AV on TAL giving.
Giving is a unique online crowdfunding and crowdsourcing platform that connects willing and kind donors with those in need of help. Tall Giving is an absolutely free to use, super simple, user-friendly, and an impactful platform. With Tall Giving, individuals and organizations can give and receive timely help and support in multiple ways, including fundraising, blood donation, plasma donation, scholarships, internships, volunteering, mentoring, career help, board member, event speaker, podcasts, COVID help. Tall Give plus campaigns. Become a kindness ninja and drive lasting social change. Join Tall Giving now. Giving is a unique online crowdfunding and crowdsourcing platform that connects willing and kind donors with those in need of help. Tall Giving is an absolutely free to use, super simple, user-friendly, and an impactful platform. With Tall Giving, individuals and organizations can give and receive timely help and support in multiple ways, including fundraising, blood donation, plasma donation, scholarships, internships, volunteering, mentoring, career help, board member, event speaker, podcasts, COVID help. Tall Giving has a thriving community of 13.5K individuals.
We will now be taking a quick short break for about 5 minutes, but we'll all be inside the auditorium itself.
దాంట్లో పెట్టే భయ అవతల పెట్టండి జారిపోతుంది. ఏది లాగితే ఏది కూడా అదే సార్ ఆ లైటింగ్ ఏంటంటే ఫోకస్ వచ్చిందా అక్కడ దానికి పోయింది సార్ దానికి రాలేదు ఒక్క నిమిషం
So, sorry for that interruption. Just a quick request for all the speakers. There is a circle that's marked in the center of the stage, just from a point of view of AV. Please, when you are speaking and presenting your ideas, please leverage that circle so that you are more visible to the camera. Thank you very much. Let me now invite our next speaker from HelpAge India, Yatindra Yadav, Joint Director and Acting in Charge, Telangana State and AP, HelpAge India. Will you please?
HelpAge India is a resolute entity committed to improving the quality of life for the country's aging population. Honored with the esteemed UN Population Award 2020, HelpAge India's significant efforts are multifaceted. Through 26 state offices, it addresses the concerns of approximately 138 million senior adults. Their programs are extensive and varied. HelpAge India's actions impact numerous lives, ranging from running mobile health units and performing cataract procedures to offering employment possibilities through self-help groups and support. Society where every elder can lead a dignified and fulfilling life.
Mr. Yatendra Yadav, please. Movement.
Slides itu
Slide move forward, back.
ఇది forward.
Yeah, be great.
A very good morning all and greetings from HelpAge India. I am Nitindra. I was a volunteer for HelpAge from my childhood because there are many youth present here just by motivation. And after finishing my social work, I just joined HelpAge India 18 years back. This is my 19th year with HelpAge, thanks to the organization for giving me an opportunity to serve the cause. And HelpAge India, we have started operations in India in 1978. So you will be wondering, right? Because 1978 there was strong joint family system existing. So people were wondering why such an organization is needed to take care of elderly when already there was an existing system. The social system was already present, eminently seen. So the answer came up in 1990s where there was globalization and urbanization, where there was a lot of migration of youth from even rural to urban and even on global basis. So this was very vibrantly felt. As a result of it, the entire social structure got a drastic change. So even including the family structure, the Indian family structure got a massive blow with this. So this youth are very dynamic, energetic, and they are also philanthropic in nature. That's a positive thing in this. Because recently I was reading an article, it says 90% of youth are philanthropic in nature. That's a positive gesture for any country. So I'm very happy to note this. And also, these youth who are very energetic, they believe in sharing. Sharing is, this is something, sharing is what? Good, sharing is caring. I do share my Wi-Fi, I do share my Netflix account and all. How many of you may know? How many of you share? Do you share? May I have your hands raised? Do someone share? Oh, great. So many of us share. So what's happening? Fortunately or unfortunately, even elders are being shared in the family system. So before, when we used to call, we used to say, "Uncle, how are you?" Now when we are calling, we are saying, "Uncle, where are you?" So we are asking them, "Are you with your son? Are you with your daughter? Are you abroad babysitting? Are you there delivering? Where are you right now?" That's the situation where we are in. And no one to be blamed. This is the impact of the social change, the framework, the family changer, which is drastically changing. So many youngsters tell me the best part of the life is aging. So they say, "What is there, uncle? Aging is good. Aging is happiness. Aging is relaxing. We are the persons who are working hard. What is it? They get pension and they are very much happy, enjoying their life." Is it so? Or maybe not. We don't know because we never had time to look into their lives, isn't it? So I thank the organizers for giving us an opportunity so that now we are going to see really, is it true? Is it that really aging is such a blissful situation? Let's see. Let's see it through their eyes actually. There are many elderly, my friends, who are deprived of primary health care. Believe me, it's not the poorest class. It's even the middle and the lower middle classes who are unable to cope up with the medical charges, the billings and the medical treatment, which has become a costlier affair now. Right? There are many destitute elderly, the orphaned elderly we call them so, who they don't have any children to take care of. They are nowhere to go. There are widows, there are widowers. They don't know what to do. They don't have any vision for the future. There are no planning. Social security is available. And also, There are many elderly who are residing in old age homes. And please note, they are not orphans. They are as per our survey, there are 99% of elderly who are in old age homes have their own families. Then how can they have landed up here? Because of small misunderstandings and conflict in the family. They are eagerly waiting in the old age home that some time down the line someone may counsel and rejoin them in the family. Who will do that in this busy life? They are all alone staying there when their families are staying at some other places. It's so pity to see that they are away from the family after putting so much of their efforts in bringing them up. So there are many such elderly, and don't think that elderly whoever are in the old age homes are orphans. No, they aren't. There are 90% of elderly in unorganized sector. When we say of elderly, we think that they are all pension holders and they have some income security. No. The income security is available only for 10% of the elderly population, especially in India. 90% are working in the unorganized sector where they have to work daily to ensure that they get food daily. And also there are many destitute elderly. Many of you, when you stop at the signals in your busy life, you might be witnessing some elderly people. From where they have all come to these urban hubs. And this mischief is done by their own children. It's very pathetic to see and witness. What they do, they technically bring this elderly from the rural and tribal areas. They abandon them at the bus stops, railway stations and government hospitals. Wherever you visit these places, there are a number of elderly people who are abandoned by their children. They are not orphaned elderly, they are elderly who have been abandoned by their own kith and kin. So eventually what they do, because of aging, they can't work. So their age doesn't permit them to work. So they are forced beggar force, which are residing in the urban areas. When we are talking of slum clearance, when we are talking of beggar-free metros and all, these are the elderly who have lived a dignified life in their own rural and tribal areas. They have their families back. So when you stop at any signal, when you see this elderly, don't look upon them as someone who is really a destitute, poor and untouchable. They have led their life in a really good way. There are many elderly, if you ask elderly what is bothering you, it's not financial security or any riches or any comforts. They are worried that their last ritual should happen in the hands of their children. It's really a tragedy. Really, if you, out of 10 elderly, 8 of them are really worried, because as per the Indian system, religious system, it's the children who will do their last rituals. So they are not there, they are migrated to some other places. Now many of you, even including me, we are witnessing marriage ceremonies online, right? Recently, one of my cousins' marriage was live aired. That's how the trending is going on. Now, unfortunately, the last rituals are being aired live. Why? Because children are unable to attend their final rituals. Their kith and kin are doing it. They are performing it on behalf of them. So the children are sitting somewhere and witnessing. So parents are horrified because of the social change. They are not at peace of mind in the end of their life. So this is the situation where some elderly are. And my friends, an author unknown, it is said death is the biggest tragedy in anyone's life. Okay, if someone says, I am very much happy embracing death, then their life should have been very terrified, right? We never want to hug death, right? In Telugu, it is said, ఈ ప్రపంచంలో చావు కంటే భయంకరమైనది ఏది లేదు. ఎవరైనా ఒక వ్యక్తి నాకు చావులోనే సంతోషం ఉంది అనుకున్నాడంటే తన లైఫ్ అతి పెద్ద ట్రాజడీ ఉంటుంది. There are, my friends, lakhs and lakhs of elderly people who doesn't want to see tomorrow. They doesn't want to see tomorrow. They just want to have a peaceful death, not peaceful life. Why? Because they don't see any hope. They can't see any happiness. They don't have anyone to talk to them, show some love and respect to them. They don't feel interested in their life. So they wait for death to happen. So there are many such elders in these busy lives. So what do we do as a Helpage India? From 1978, we are visualizing and we are trying to create an age-friendly society where elderly can be provide support system and have a happy lifestyle. For which what we do lot of welfare activities and developmental activities like in AV which they have showcased. Apart from this, we develop ecosystems for them. We create elder self-help groups. We facilitate formation of elder self-help groups. We work with the senior citizen associations. Also, we work with community-based organizations so that an ecosystem in the community is built where the elderly are taken care by the society itself. At the other part, we do lot of advocacy activities. We work on rights and entitlements of elderly. We work with different stakeholders, with the state and central governments, to ensure that their rights and entitlements are protected. And why do we do all these things? Why do we want to? What is our main purpose? Our purpose is that elderly should be seen as part of the society. We do Helpage as a family, we don't see elderly as a standalone entity or a beneficiary where some relief activity or some charity should be happening. We visualize that elderly should be taken care of, part of the family system, part of the society. We want to ensure that the society and the neighborhood should be taking care of them. And the government or NGO should be playing a facilitation part wherever possible. So we strongly believe that the age-friendly society should be strengthened so that elderly are respected, taken care by their own families. So we work more on intergenerational approach also, so that the younger generations really happen to take care of elderly. And at last, my friends, one of my professors, when I was completing my social work, he told me, Yatindra, social work is a thankless job. Then how come I am in an NGO and how come there are so many NGOs working? Because my friends, as an NGO family, we see this entire world as one family. Okay, we see brotherhood in everyone. We see love and affection in others. Okay, we don't need thanksgiving. We feel happy when some other feels happy. That's how we work. That's how we together try to make some change in the society. So, while thanking the organizers for organizing such a beautiful platform for us to express what we are doing our best to the society, also on behalf of our NGO family, my friends, I cordially welcome you all on behalf of Helpage India and also the NGO partners. I cordially invite all of you who are here and witnessing and this hearing. We humbly invite you and request you all to be part of this generous cause. So let's make a change. Let's ensure that we create a better world for the future generations, also a world where elderly are respected and taken care of. Thank you very much. Sarve Jana Sukhino Bhavantu. Thank you. Thank you very much, Chaitanya garu. Challenging task, ma'am.
Yes.
I'm looking at him, I'm looking at him. So that's keep me active.
Okay.
No, this keeps us active.
First of all, thank you so much, Garu and Helpage India. This problem is a big problem, and it's not just in India, all over the world. We are seeing this, and incidentally, in United Kingdom, they actually appointed a minister for happiness, and they have created a call center only to talk. This call center is meant for any elderly people to, call up over there because they're not finding people to talk. So anytime they feel lonely and they want to talk to people, they're actually calling, this center. So we have so many students, so many youngsters, and anybody who can give that, comfort, talking to them. I'm also seeing, several artists, dance groups. Instead of doing programs all over the place, you can go to elderly shelter, do a program, painting programs, drawing programs, all of those things. So I think what you're doing is amazing, and hopefully our student community can help in any shape or form. Thank you.
Truly said, ma'am. Thank you. For the volunteer force especially, we Helpage India, we have a volunteering program called HUG, Help Unite Generations. Also we do SAVE program, Student Action for Value Education, where in schools under moral values, we go and sensitize them to how to take care of their own grandparents. So we organize grandchildren and grandparents days in association with many schools. Also we encourage youth to form friends for elderly communities in their own residential areas, in apartments, wherever they are, so that they go and just talk, like ma'am was rightly saying, we encourage them just to go and talk. Because sometimes it's not the medicine, but it is only the human touch which will heal. It's not riches, it's only love which will heal them. And especially with the elderly, only need this. So I invite you on behalf of Helpage India, do please join us in this noble cause. Thank you, especially to the audience. God bless you all, ma'am. This was a wonderful platform for us. Thank you.
Thank you, Mr. Yatindra Yadav. We now request Veena Garu to give the memento. Yes, sure. Thank you very much.
Sir, thank you very much, sir. By God's grace, Helpage India is working from Jammu, Kashmir to Kanyakumari. We have state offices all over, including the union territories also. We have a website, www.helpageindia.org. You can find out and enroll directly or walk in to the state offices. We have a state office in all the state capital cities. You can just walk in and talk to us in for Telangana and Andhra Pradesh. I am the state in charge for the both states of Telangana and Andhra Pradesh. I am the team lead. So you are always welcome to walk in. It's your family and it's your home. You are always welcome to just come in and do whatever best you can for the noble cause. Thank you.
We now invite our next NGO, Vikalp Sansthan. Our speaker is Usha Chaudhary. She is the founder for Vikalp Sansthan. She is from Rajasthan. AV, please.
$20,000 child marriages were prevented, 30,000 girls were educated, and 6,500 women were liberated from violence. Usha Chaudhary's impact is a symphony of empowerment resonating across Rajasthan and beyond. Her journey, ignited by personal struggle, exudes resilience and unwavering determination. From challenging gender norms on rural roads to addressing systemic injustices, she shines as a guiding light. Over 25 years, she's dedicated her life to empowering women and girls in Rajasthan, co-founding Vikalp Sansthan to advocate against gender-based violence and child marriage. Usha's story reminds us that one person's dedication can ripple into waves of change, shaping a brighter, more equitable future for all. She stands as living proof that passion and action can catalyze movements and inspire generations. TALTalks warmly welcomes Usha Chaudhary on the stage to share her remarkable journey.
Thank you very much. Let's welcome Usha Chaudhary on the dais with a huge round of applause. She's coming all the way from Rajasthan.
Thank you so much for coming. Here is the just only.
Thank you, Usha Garu.
Thank you so much, and hello everybody. Touch a Life, all team, Osmania University, all guests, and all youth change makers, hope of the future. So Sorry, I will speak in Hindi because Hindi is my first language. I try to speak slow so everybody can understand. मैं जब 14 साल की थी, मैं 10th स्टैंडर्ड पास किया और जैसे हर बच्चे अपने ग्रैंड पेरेंट्स के घर जाते हैं, तो मैं भी अपने ग्रैंड पेरेंट्स के यहाँ गई और मुझे लगा कि हम खेल रहे थे, मैं और मेरी कजिन सिस्टर। अचानक से कुछ गेस्ट आते हैं गाड़ी में और गेस्ट रूम में चले जाते हैं। हमें लगता है कि गेस्ट आए हैं आंटी के साथ तो चले जाएंगे। फिर हम दोनों मुझे और मेरी कजिन सिस्टर को चाय देने के लिए भेजा जाता है। तो हमें नॉर्मल लगा कि बच्चे जनरली चाय देने जाते ही है, चाय दे दी जाती है और उसके बाद अचानक से 1 आवर के बाद नीचे गेस्ट आते हैं गेस्ट रूम से और मुझे बिठा दिया जाता है गुड़िया की तरह। मेरी मांग में सिंदूर भर दिया जाता है, अंगूठी पहना दी जाती है और ऑर्नामेंट, साड़ी, कपड़े सब कुछ दे दिया जाता है। मुझे समझ नहीं आता है कि ये क्या हो गया और 2 महीने बाद मेरी शादी तय कर दी जाती है। मैं बचपन से बहुत सपने देखती थी। मेरे आइडियल रहे थे विवेकानंद, राजा राम मोहन राय, सावित्री माँ फूले, ज्योतिबा फूले, इंदिरा गांधी, मदर टेरेसा। इनको बचपन से मैं पढ़ती आई थी, देखती आई थी। मुझे लगता था कि ये सब अपनी लाइफ बदल रहे हैं, इन्होंने इतने लोगों की लाइफ बदली है, सोशल नॉर्म्स बदले हैं, सोशल ट्रांसफॉर्मिंग किया है और बहुत हार्ड विडो मैरिज, रीमैरिज, गर्ल्स एजुकेशन, इतना सब कुछ किया है, तो मुझे भी ये करना है। तो मैं बचपन से ये देखती थी। मेरी खुद की माँ की 13 साल में शादी हो जाती है, 14 साल में मैं पैदा हो जाती हूँ और यही मेरी सब आंटी और लोगों की स्थिति थी। लेकिन मेरे फादर गवर्नमेंट जॉब में थे और हम टाउन में रहते थे, तो मुझे लगता था ये मेरे साथ तो नहीं होने वाला है। तो जब ये सब हुआ तो मैं अचानक से, मुझे समझ नहीं है क्या हुआ, और मैं थोड़ा बोलने वाली लड़की थी, तो सबको लगा कि ये बोलेगी, चीखेगी, चिल्लाएगी, तो गेस्ट फटाफट ये सब करके गुड़िया की तरह 5 मिनट्स में करके चले जाते हैं। उसके बाद मैं रोती हूँ। पर हम सब जानते हैं कि इंडिया में बहुत बड़ा एक बायसेस है कि लड़की की एंगेजमेंट होती है, शादी होती है तो लड़की रोती है। तो किसी ने भी उसको सीरियसली नहीं लिया, लगा रोएगी 3-4 दिन, इसको लग रहा है भाई इस घर से जाना है इसको, तो इसलिए रो रही है। तो फ्रेंड्स, स्टोरी यहां से स्टार्ट होती है और मुझे लगता है कि नहीं, मुझे ये शादी नहीं करनी है, मुझे ये बाल विवाह नहीं करना है, मुझे तो ये जो मेरे आइडियल्स हैं, मुझे इनकी तरह कुछ करना है। और मैं उस शादी को ना कहती हूं। पर ये इतना आसान नहीं है। घर की बड़ी बेटी होना, पूरे फैमिली में ये शादी का ट्रेंड होना, पूरी कम्युनिटी के लिए, और मेरे बाद 3 छोटे भाई बहन होना, तो सबको लगता है कि ये शादी तोड़ेगी तो किसी की भी शादी नहीं होगी। तो ये, लेकिन हालांकि उस शादी को मैं ना कह देती हूँ। मैं कहती हूँ कि मुझे अगर सुसाइड करना है तो मैं मेरी खुद का लेटर लिख के सुसाइड कर लूंगी, कोई दिक्कत नहीं है, लेकिन मैं ये शादी नहीं करूंगी। तो मुझे इस तरह से चीजों के, और ये फ्रेंड्स, तब मैंने डिसाइड किया कि मुझे बाल वधू नहीं बनना है, मुझे बालिका वधू नहीं बनना है, मुझे एज ए सोशल एक्टिविस्ट बनना है। जो मेरी तरह से मैं शादी रोक पाई, लेकिन हमारे देश की, मेरे राजस्थान की हजारों लाखों लड़कियों की यही स्टोरी है। वो चाहती है डॉक्टर बनना, इंजीनियर बनना, सोशल वर्कर बनना, टीचर बनना, प्रोफेसर बनना, कलेक्टर बनना, लेकिन नहीं बन सकती है। तय किया जाता है कि उनकी शादी कर दो, उनका काम घर संभालना है, चुप रहना है, मोबिलिटी रिस्ट्रिक्टेड रहना है, उनको ये सब नहीं करना है। तो वहां से मैंने डिसाइड किया कि मेरी 15 साल की में मुझे बाल वधू नहीं बनना है, मुझे सोशल एक्टिविस्ट बनना है। और यहीं से मेरी और विकल्प की स्टार्ट हो जाती है जर्नी, क्योंकि ये लाखों करोड़ों हमारे देश की लड़कियों की यही स्थिति है जो लड़कियां सब चाहती है। मुझे लगता है कि मैं तो मेरी लाइफ को बदलने में कामयाब हो गई, लेकिन जो लड़कियां ये सब चाहती है, उनकी लाइफ बदलने के लिए मेरी जिम्मेदारी है कि मैं एज ए सोशल एक्टिविस्ट कुछ काम करूं। एनजीओ और वो सब चीजों का नहीं पता था, लेकिन एक जुनून था। मेरी माँ की लाइफ देखी थी, मेरी आंटीज की लाइफ देखी थी, नेबरहुड वुमेन की लाइफ देखी थी, गर्ल्स की लाइफ देखी थी जो छोटी उम्र में शादी होके और एक 16, 17, 18 साल में 2-3 बच्चे हो जाते हैं, घर तक सीमित हो जाती है। तो मेरे अंदर वो पैशन था और मार खाई, सब कुछ किया, और हम आज उस्मानिया यूनिवर्सिटी डिस्टेंस एजुकेशन सेंटर में बैठे हैं। मैंने उसके बाद की अपनी पढ़ाई डिस्टेंस एजुकेशन से की है। पूरी पढ़ाई मुझे लगा कि पढ़ना ही, जब सावित्रीबाई फुले माँ कहती है कि पढ़ना इंपॉर्टेंट है, तो मुझे लगता है कि पढ़ना इंपॉर्टेंट है, और शायद हम सब आज पढ़े हैं इसलिए यहाँ बैठे भी हैं। तो मैंने पूरी पढ़ाई मेरी डिस्टेंस एजुकेशन से की और तभी से काम शुरू कर दिया। लगा कि कुछ किया जाना चाहिए, तो विकल्प संस्थान बनाई जहां हम सब ये काम करते हैं लड़कियों महिलाओं की जिंदगी को बदलने के लिए, चीजों के लिए। आज हम 2024 में बैठे हैं, चांद पे चंद्रयान में महिलाएं जा रही है, उसकी लीडर महिलाएं हैं। कोई भी ऐसा सेक्टर नहीं है कि जहां महिलाएं पूरे वर्ल्ड में और इंडिया में लीड नहीं कर रहे हैं। लेकिन अगर आज भी हम रूरल एरियाज की बात करें तो आज भी हमारे यहाँ स्थिति जो अभी प्रेजेंट किया कि गांव में हेल्थ की ये स्थिति है, इसी तरह से एजुकेशन और मैरिज की भी ये स्थिति है। हमारे यहाँ लड़कियां 5वीं के बाद नहीं पढ़ पाती। मैं इस एरिया में काम करती हूँ जहाँ 5th के बाद लड़कियां स्कूल का मुंह नहीं देख पाती है। कुछ लड़कियां लड़ाई करके 8th तक जा पाती है, 8th के बाद एकदम से परसेंटेज बहुत डाउन हो जाता है। जब पूछते हैं गांव में कि अगर 100% लड़कियां 5th में थी तो 8th में जाके 50 हो जाएगी, और 10th में जाके 10 लड़कियां रह जाएगी, 11th में जाके ओनली 1 रह जाएगी, और कॉलेज में 0 है। ये एक डेटा है हम लोगों के यहाँ का जो लड़कियों की स्थिति दिखाता है। और आज भी लड़कियों के नाम धापू, माफी, नाकुशा, आचुकी रखा जाता है कि भगवान एक लड़की हो गई हमारे यहाँ, दूसरी लड़की नहीं चाहिए, अब सॉरी माफ करो, हमें लड़कियां नहीं चाहिए। तो हम लोग उन लड़कियों के नाम बदलने का भी काम करते हैं। उन लड़कियों का नाम हम क्यों उस जीवन भर उस नाम से वो रहे, हम उनके नाम ज्योति, खुशी, हैप्पीनेस, किरण, लाइट्स, ऐसे नाम, चाहे वो कितनी भी बड़ी महिला हो या लड़की हो, हम सबके नाम बदलते हैं। कार्ड्स बनाते हैं, कार्ड्स जाके सेलिब्रेट करते हैं और एक साथ बुला के भी उनका सेलिब्रेट करते हैं कि वो इस बैड नेम के साथ, इस नाम के साथ क्यों जिंदगी भर रहे। तो सारे खुशी के नाम उनसे पूछते हैं आप अपना नाम क्या रखना चाहती हो, किस तरह का नाम रखना चाहती हो, उस तरह की नाम हम उनके बदलते हैं। और लड़कियों को कोशिश करते हैं कि एक स्माइल और चीजें, इन नामों से वो चीजें आगे जा पाए। ये कहां से हो पाएगा? हाँ, और इतनी सारी स्टोरीज का बहुत सारे इश्यूज है। चाइल्ड मैरिज एक इशू है, हेल्थ इशू है, एजुकेशन है, लड़कियों को सेक्स सिलेक्टिव अबॉर्शन है, ये सारे कई सारे इश्यूज है। डोमेस्टिक वायलेंस तो हर जगह है, राजस्थान के साथ साथ पूरे देश में डोमेस्टिक वायलेंस है। लड़कियों को एक, हम कहते हैं कि लड़कियों को वैल्यू करो, अपनी डॉटर को वैल्यू करो, क्योंकि ये सबसे बड़ा इशू है वैल्यू करने का। अगर एक पेरेंट्स चाहेंगे कि मुझे अपनी लड़की को कलेक्टर बनाना है, डॉक्टर बनाना है, तो वो बना देंगे। तो इसलिए बहुत इंपॉर्टेंट है कि अपनी लड़की को वैल्यू करो। ये वैल्यू नहीं करने का है कि उसको एजुकेशन नहीं देना है, उसको जल्दी शादी कर देना है, या उसको पराई मानना है। पराई का मतलब दूसरे घर, इन-लॉज के यहाँ जाने वाली, तो मैं इस पे क्यों इन्वेस्ट करूं। तो अपनी लड़कियों को वैल्यू करो। वैल्यू का हमें सबसे ज्यादा लगता है कि अगर हम अपनी लड़की को वैल्यू करेंगे तो हम शायद उसको चीजों को आगे जा पाएंगे, ले पाएंगे चीजों को। हमारा विजन है विकल्प का कि एक ऐसी सोसाइटी बने जहां पीस हो, जस्टिस हो, इक्वालिटी हो, उस तरह की सोसाइटी बने। और उसके लिए हम, आप जैसे जो यूथ है, आज यहाँ उस्मानिया यूनिवर्सिटी के यूथ बैठे हैं, यूथ्स को हम तैयार करते हैं, क्योंकि यूथ में वो करेज है जो सोशल नॉर्म, जेंडर स्टीरियोटाइप, बायसेस को ब्रेक कर सकते हैं। और ब्रेक किए हैं, हम सब ने ब्रेक किए हैं उनको, और शायद हम सब ने ब्रेक किया इसलिए आज हम सब यहाँ बैठे हैं। अलग अलग तरह से सबने ब्रेक किया है स्टीरियोटाइप को। तो यूथ को हम ऐसे प्लेटफॉर्म देते हैं जिससे वो आए, अपनी बात करे और बिना बायसेस के चीजों को आगे ले पाए, और एक ऐसा स्पेस क्रिएट करे जहां वो जो चाहे अपॉर्चुनिटी ले पाए, जो चाहे बन पाए, और एक दूसरे को सपोर्ट कर पाए। एक बहुत लाइन हमारी टैगलाइन है विकल्प की, ये इसके पीछे हमारी टैगलाइन है, क्योंकि सबको लगता है फिल्में देख के, ओल्ड स्टोरीज देख के, कहानी देख के कि कोई राजकुमार प्रिंस आएगा, घोड़े पे ले जाएगा, जिंदगी बदल जाएगी, कोई एंजल आएगी, छू कर देगी और हमारी जिंदगी बदल जाएगी। और लगता है कि 3 घंटे की बॉलीवुड मूवीज के स्टार्टिंग दुखों से होगी, रोने धोने से, और एंडिंग हैप्पी हो जाएगा। हम कहते हैं लड़कियों को लाइफ ऐसी नहीं है, इन सब चीजों से बाहर आना है। Who are you waiting for it? It is you and only you. तो ये हमारी टैगलाइन है, कोई एंजल, कोई प्रिंसेस, कोई 3 घंटे की बॉलीवुड मूवी लाइफ नहीं बदलेगी। हम खुद हैं जिसका हम इंतजार कर रहे हैं। हमें खुद को अपनी लाइफ बदलनी है, हमें खुद को अपनी जिंदगी को बदलना है। ये बहुत इंपॉर्टेंट है। इसलिए अगर आप मेहनत करोगे, आप बोलोगे, हमारे राजस्थानी में एक कहावत है कि जब तक बच्चा रोता नहीं है, मदर भी उसको मिल्क नहीं देती है, दूध नहीं पिलाती। लगता है बेबी सो रहा है, अभी तो इसको सोने दो, मैं अपना घर का काम कर लूं। तो हम कहते हैं कि जब तक आप हेल्प के लिए आवाज नहीं उठाओगे, जब तक आप डिमांड नहीं करोगे, जब तक आप अपने लिए नेगोशिएट नहीं करोगे, जब तक आप अपने लिए आवाज नहीं उठाओगे, लड़ोगे नहीं, रोगे नहीं, जिद नहीं करोगे, तो अपनी दुनिया नहीं बदलोगे। आपकी जिंदगी आपके जिद करने से, खास करके जो हमारी लड़कियों की स्थिति है वो तो इसी तरह की है। तो खास करके जब आप जिद करोगे, अपनी लाइफ बदल पाओगे, पॉजिटिव जिद करोगे, लड़ाई करोगे, नेगोशिएट करोगे, तो अपनी जिंदगी बदल पाओगे। और सिर्फ आप ही हो जो अपनी जिंदगी बदल सकते हो। कोई राजकुमार, कोई एंजल, कोई फिल्म सिटी नहीं आने वाली जो आपकी जिंदगी को बदल सकती। सॉरी, मेरे से ये क्या हो रहा है, सॉरी इसको, हाँ। इस तरह की मार्जिनलाइज्ड जो लड़कियां हैं, हमारा जो अधिकतर काम है ट्राइबल, मार्जिनलाइज्ड, रूरल, रिमोट एरियाज जहां पे गवर्नमेंट एक्सेस या और भी फैसिलिटीज नहीं पहुंचती हैं, उस तरह के ट्राइबल बेल्ट्स में, रिमोट एरियाज में हम गर्ल्स के साथ काम करते हैं। और गर्ल्स को, और जो भी सोशल वीकर्स या कल्चरली सोशल वीकर्स फैमिलीज है, उन फैमिलीज के साथ विकल्प का काम है। उनके साथ लगातार लड़कियों को कैपेसिटी बिल्डिंग बनाना, ये सब करना। और राजस्थान के 12 डिस्ट्रिक्ट्स में, राजस्थान के 12 डिस्ट्रिक्ट्स में हमारा काम है। जो भी अंडर प्रिविलेज 12 डिस्ट्रिक्ट्स है, उन तरह के 12 डिस्ट्रिक्ट्स में काम है विकल्प का। सॉरी, ये बहुत मेरे से तो फास्ट जा रहा है, प्लीज हेल्प करेंगे इसमें, कहाँ से करना है ये मुझे या यहाँ पे आ जाओ, ठीक, ये इससे पीछे, हाँ जी, ठीक है। कहाँ से करना होगा इसको? अच्छा ठीक है, ठीक, थैंक। उसी तरह, क्योंकि ये इतना इजी नहीं है ना कि कह देंगे और हो जाएगा। तो कैसे लड़कियों को, गर्ल्स को प्लेटफॉर्म उपलब्ध कराए, ये बहुत इजी है। तो हमारा बहुत एक मेन कोर है कि गर्ल्स एजुकेशन फॉर एम्पावरमेंट। एजुकेशन ऐसी चीज है जो हम सबको एम्पावर करती है। और एक बात बोलती हूँ, मैं हमेशा बोलती हूँ सब लड़कियों से कि आपके ऑर्नामेंट्स कोई ले सकता है, आपकी चीजें कोई चोरी कर सकता है, पैसे कोई ले सकता है, एजुकेशन एक ऐसी चीज है जो कोई चोरी नहीं कर सकता है। आपके 10 इयर्स बाद, 20 इयर्स बाद भी डिग्री है आपकी। आप कहो कि आज मुझे जॉब नहीं करना है, लेकिन आपको 10 इयर्स बाद लगे मुझे जॉब करना है, मुझे कुछ चाहिए, तो आप 10 इयर्स बाद कहोगे, ओह हेलो, आई हैव द मास्टर ऑफ सोशल वर्क, आई हैव द MBA, आई वांट्स टू जॉब। तो उसमें आपको, मैं कहती हूँ 20-30,000 नहीं, 15,000 का तो आपको मिल जाएगा। तो एजुकेशन ऐसी चीज है जो किसी भी एज में, किसी भी समय आपके काम आती है और आपको एक करेज देती है, आपको एक कॉन्फिडेंस देती है कि आपके पास कुछ है जो आपके किसी भी बुरे वक्त में काम आएगा और आप उससे अपना सरवाइव कर सकती हो, किसी के सामने आपको मांगना नहीं पड़ेगा। तो इसलिए हम एजुकेशन फॉर एम्पावरमेंट कहते हैं, बहुत इंपॉर्टेंट है। आज हमारे बिना सब लड़कियां नाम कर रही है, चाहे साक्षी मलिक हो या PV सिंधु हो, हर एक लड़कियां नाम कर रही है स्पोर्ट्स में, लेकिन वो स्पोर्ट्स सिर्फ मेट्रो सिटीज तक है जहां ऑल फैसिलिटीज है। तो हम हमारी रूरल गर्ल्स को भी स्पोर्ट्स फॉर एम्पावरमेंट प्रोग्राम्स करते हैं और हमारी लड़कियां नेशनल तक खेली है, नेशनल मेडल्स जीत के लाई है, हमारी लड़कियां स्टेट मेडल जीत के लाई है। उनको वो प्लेटफॉर्म्स देते हैं जिससे वो लड़कियां आगे आ पाए। हम बहुत कोशिश करते हैं कि चाइल्ड मैरिज रुके, जल्दी शादी नहीं हो, लड़कियों को प्लेटफॉर्म्स मिले, लेकिन फिर भी कुछ लड़कियों की शादी हो जाती जिन तक हमारी रीच नहीं होती है। तो हम उन यंग मैरिड गर्ल्स की जो इन-लॉज के साथ रहती है, उनके साथ भी एक काम करते हैं कि वो कैसा सेल्फ स्टीम देके। एक बार यंग मैरिड गर्ल्स के साथ में काम कर रही थी। मेरा एक बहुत फेवरेट एक्सरसाइज है ड्रीम देखना, और सबको ड्रीम देखना चाहिए, क्योंकि ड्रीम देखेंगे तो हम एक्शन करेंगे और ड्रीम पूरे करेंगे। तो पूछा कि आपका ड्रीम क्या है? पिन ड्रॉप साइलेंट। मुझे लगा कि शायद मैं ठीक से समझा नहीं पाई हूं, तो मैंने कहा कि प्लीज आप देखिए आपका सपना क्या है, क्या चीजें हैं। तो उन्होंने फिर भी पिन ड्रॉप साइलेंट। मैंने वापस ट्राई किया मेरे बेस्ट वे से, मुझे लगा मैं गलत हूं, ये सही है। तो उन्होंने कहा कि हम सपना कैसे देख सकते हैं? मैंने कहा क्यों, सपना देखने का तो सबका हक है, पूरा हो नहीं हो एक मैटर। तो उन्होंने कहा नहीं, मेरी लाइफ मेरे इन लॉज और मेरे हस्बैंड के अलावा है ही नहीं। मेरी मदर इन लॉ, मेरे हस्बैंड कहेंगे कि मुझे मेरे नेटल फैमिली जाना है 2 डेज, तो मैं 2 डेज ही जा पाऊंगी। तो मैं सपना कैसे देखूं, कैसे पूरा करूं? तो हमें लगा यहां तो सपना देखना भी बंद है। तो फिर हमने उन यंग मैरिड्स जो वुमेन थी, गर्ल्स थी, उनके साथ काम स्टार्ट किया। यंग मैरिड कपल्स के साथ हम काम स्टार्ट करते हैं, क्योंकि लगता है कि दोनों के साथ काम करना जरूरी है अगर उनकी लाइफ को वो करना है। तो यंग मैरिड कपल्स के साथ हम कैसे वो कंसेंट, सेक्सुअलिटी, चॉइस, जॉइंट ड्रीम्स और इन सब की चीजों को देख पाए। बहुत बार 10 ईयर साथ रहते हैं तो भी पता नहीं है कि आपके पार्टनर का सपना क्या है। हम दोनों से पर्सनल एक्सरसाइज करवाते हैं सेपरेट करके, और दोनों को फिर मिलाते हैं, तो दोनों के काफी बार दोनों में रहता है पता नहीं 10 ईयर साथ रहने के बाद भी पता नहीं होता है कि इनका सपना क्या था और इसका क्या है। तो इस तरह की एक्सरसाइज से कोशिश करते हैं। जितना काम लड़कियों के साथ इंपॉर्टेंट है, उतना ही काम लड़कों और पुरुषों के साथ भी इंपॉर्टेंट है। यहाँ पे काफी यूथ बॉयज बैठे हैं। जेंडर इक्वालिटी के लिए लड़कों और पुरुषों के साथ काम करना उतना ही इंपॉर्टेंट है, इसलिए हम ये सब चीज लड़कों पुरुषों के साथ भी काम करते हैं। इकोनॉमिक एम्पावरमेंट का काम है, हम हेल्पलाइन रन करते हैं जिसमें 360 डिग्रीज के सारे सपोर्ट हम करते हैं। हमें लगता है कि लड़कियों को पढ़ा तो दिया, 12th तक एजुकेशन करा दी, उसके बाद पेरेंट्स शादी कर देते हैं। तो हमें लगा कि कॉलेज के लिए, डिग्री के लिए स्कॉलरशिप बहुत जरूरी है। तो हमने पर्सनल डोनेशन इकट्ठा किया और स्कॉलरशिप लड़कियों को पढ़ाते हैं। अभी हमारी लड़कियां कांस्टेबल की तैयारी कर रही है, जीएनएम कर रही है और कंप्यूटर की डिग्रीज कर रही है, बैचलर्स कर रही है। जो लड़कियां कभी, उसके गांव में लड़कियां कभी 5वीं से आगे नहीं पढ़ पाती थी, आज 40 लड़कियां कॉलेज जा रही है। ये एक बदलाव दिखता है। इस लड़की की बाल विवाह हो जाता है और इसकी पढ़ाई छूट जाती है और आज ये पुलिस कांस्टेबल्स है। ये जीएनएम कर रही है। ये लड़की जो, जिसका भी 4 साल की उम्र में शादी हो जाती है, आज ये जीएनएम कर रही है। वो उसके गांव में वो पहली लड़की है जो डिग्री कर रही है। इसका नाम महिला का वग्दी रखा जाता है, क्योंकि वग्दी मतलब वेस्ट पेपर जो हम कबाड़ी वाले को देते हैं। इसका नाम हमने बिंदु करवाया बदल करके कि अब इतनी उम्र में वग्दी नाम है, यू आर नॉट वेस्ट पेपर, तो इसका नाम बिंदु करवाया। आज हमारी लड़कियां योगा टीचर है, जीएनएम्स है, टीचर है, पुलिस है, सोशल वर्कर है लड़कियां। जिस गांव में लड़कियां 5वीं के बाद नहीं पढ़ पाती थी, आज वहां लड़कियां सोशल वर्कर है और सर्वाइवर वुमेन का इस तरह की लाइफ है कि वो अपनी लाइफ को देख पाती है, मंच पे खड़े होकर बोल पाती है। पीपीडी के अनुसार एचडीसी के अधिकतर गोल को हम फुलफिल करते हैं। और 20,000, जैसा आपने वीडियो में देखा है, 20,000 चाइल्ड मैरिजेस हम जो रोक पाए हैं, 30,000 गर्ल्स को हायर एजुकेशन दे पाए हैं, 6,500 वुमेन्स को, सर्वाइवर को हम सपोर्ट कर पाए, काउंसलिंग कर पाए हैं और स्कॉलरशिप दे के लड़कियों को हम कोशिश करते हैं। ऐसा है, आप लोग वॉलेंटियर बनिए, हमारे काम से जुड़िए, सपोर्ट करिए और जहां भी है गर्ल्स इक्वालिटी के लिए, जेंडर इक्वालिटी के लिए काम करिए। हमारी हेल्पलाइन से देश भर में कोई भी केस आते हैं, हम देश भर के केस हेल्पलाइन पे लेते हैं, वहां से आप केसेस ले सकते हैं, सपोर्ट कर सकते हैं, ऑनलाइन सपोर्ट कर सकते हैं, आने की जरूरत नहीं, इंटर्नशिप कर सकते हैं आगे, वो सब भी काम आप कर सकते हैं। और लड़कियों और महिलाओं के लिए कैसे एक इक्वल फ्री सोसाइटी बने, वो हम कर सकते हैं। और आपकी इंटर्नशिप, वॉलंटियरशिप करके लेट्स प्रोटेक्ट दिस स्माइल टुगेदर, ये हमारा एक कोशिश है। Thank you so much, organizer, and thank you so much, Touch a Life, giving me this wonderful platform to speak my all work in 15 minutes. Thank you so much.
थैंक यू उषा जी, बहुत बहुत धन्यवाद। ऑडियंस के लिए अगर कोई क्वेश्चंस हो तो ओके, लेट मी नाउ इनवाइट वीना गारू टू विजय गारू. And Vijay Garu, can you please also
First
come
of all,
on to the
Usha ji,
dais?
thank you so much for coming all the way from Udaipur, and totally appreciate it. And you are a powerhouse. You are a dynamite, and I think the amazing work that you have done, 20,000, child marriages stopped, and supporting so many women. I particularly like the message of self-empowerment. Right? Every woman, that matter, every person needs to feel their power inside them, right? And I think your message of dare to dream, dare to chase your dreams, that's amazing. You're doing some fantastic work. We would love to take your programs and again with our TAL team, as well as I think, reaching out to so many schools and, so many different areas, like to get this message out. So definitely looking forward for a great collaboration. And I think, Dr. Padmanabha Garu was earlier talking about these child marriages and other things. I think there are wonderful ways we can all partner on this fantastic cause. So thank you for all the good work.
Thank you so much.
Yeah, Jayashree. Thank you, Ms. Usha Chaudhary, for your invigorating speech on gender equality. Can you please give her a round of applause? So all of you will now take a short break for tea, snacks, and feel free to grab the refreshments, and we'll mingle with your fellow attendees over here. We'll get back in about 20 minutes. Thank you.
We'd also like to take this opportunity to thank Osmania University and the Osmania Foundation for collaborating with us for this wonderful event. Thank you so much.